do you think about the NIH now that you were working there?
Probably shouldn't be saying this out loud. They might have funded a lab in Wuhan, China to make COVID. And Pfizer and Moderna are just getting a bunch of money from it, from all these vaccine mandates.
Roger Cholin is with the National Institute of Health.
For other vaccines, like measles or whatever, you have to go through several rounds of approval, but these were accelerated through the approvals.
Do you think that those, the mRNA stuff is safe? Think it's really effective people with the myocarditis stuff?
I think we're all going to learn when it's too late.
I think that's important. The lack of effectiveness of the vaccine product.
The 6-foot rule. Remember that? That wasn't based on any real evidence that did anything. It was completely made up.
Well, what do you think? Happened with be real with it.
Roger then brings up politics, talks about which political party he prefers and what would happen to him and NIH under an incoming Trump administration.
I think it would be worse for the NIH. I think it would be better for a Democrat to be in office. We sometimes fly under the radar of the really scrutinized. I don't think it would impact me. I don't think I have too much to worry about. That's not recording, right?
Roger Cholin is with the National Institute of Health, or NIH, and has only been on the job for 2 months.
All the other branch chiefs are 55.
Wow.
And I don't know shit. I know about the subject matter, but I don't know about any of the government, how budgets work or how the hierarchy works.
In his role, Cholin oversees 40 people and heads up the Health Data Standards Branch for a division of NIH called the National Library of Medicine.
So the U.S. National Library of Medicine, you can think of it as the nation's health library. All the major peer-reviewed journals are there, and they have electronic databases, electronic cataloging. They manage the PubMed application that makes all this information available to the general public. They manage clinicaltrials.gov, which is the application that summarizes clinical trial results. And it appears that what Mr. Cholin's division, this health data standards, is responsible for is analysis of visual data. This is X-ray and MRI data, analyze and develop new capabilities that will make these kinds of information and data more generally available for searching.
While he admits he may know nothing about the bureaucracy, he says he knows a lot about public health.
What do you think about the NIH now that you were working there? Obviously, lots of conspiracies about that. My cousin is
about Fauci? Well, I don't, so I'm not, probably shouldn't be saying this out loud. I haven't gotten the latest COVID shots and I'm not going to. There's mixed evidence about if it really does anything.
Cholin then goes on to tell our undercover journalist that people under 30 are more at risk for heart conditions from the COVID vaccine.
For people that are 30 or under, it really increases your risk for heart conditions. The data does show that. I don't even know if these vaccines stop you from getting COVID. They don't.
Really?
I don't think so. It's supposed to make you less sick if you get it. I don't know if it really prevents the transmission of it.
He is speaking casually, candidly, about the risks of the virus, the risks of the vaccine product, particularly as it relates to myocarditis, the lack of effectiveness of the vaccine product. He's saying that it doesn't prevent infection. It doesn't prevent disease. These are statements that I had made back a few years ago that I was called a liar for saying by the Washington Post.
But now there is some evidence out that NIAID, National Institute for Allergy and Infectious Disease, that's where Fauci was the director.
Okay.
They might have funded some labs to do vaccine studies and disease, to prepare for an outbreak. They might have funded a lab in Wuhan, China to make COVID. But I believe in the science. I don't it seems too much of a big conspiracy. And generally, now that I'm a Fed, people in the government do want to do the right thing. Everyone's there kind of behind this, at least maybe more so at NIH or in Health and Human Services. People want to help people improve health. So I don't know that I believe that these people are all trying to spread a virus and And then, like,
What if they work? Hypothetically.
then they should go to jail. If NIH and Fauci were actually doing this, if the proof comes out that they were funding it, maybe they were actually funding it just to, like, be prepared and shit went wrong. They were trying to study a virus so that when it did break, if and when it did break, we would be prepared for the response to it. But instead, they accidentally funded the thing that, like, caused it. I don't know. But hopefully the intentions were good up front. It doesn't, like, excuse them outright, but I don't know. Like the 6-foot rule. Remember that? Like, that wasn't, like, based on any real evidence that did anything.
Really?
It was just, and again, I think they were just trying to do the right thing, but it was completely made up. If they had said 5 feet versus 6 feet, right? Or 7 feet, like, it was all just, they just made it up.
Does anyone really trust the healthcare system? Well, thankfully, there still are some good guys left in healthcare, like our great friends at the Wellness Company. The Wellness Company has been with OMG since day one, and now they're proud to introduce the ultimate first aid emergency kit, meticulously created to ensure your access to life-saving prescription medications, personal protective equipment, and other essentials by empowering you to take control of your health journey. Now you and your loved ones will be prepared for the next shortage or whatever they try to pull. My team and I have our kits with us in the field at all times. Don't get caught without the medications you need. The Wellness Company's First Aid Medical Emergency Kit can make all the difference. Order your medical emergency kit now and save 15% by using code OMG. That's twc.health/OMG. Go to twc.health/OMG. Again, that's twc.health/OMG. Now, what's confusing is whether Raja is a villain or not, whether he's a participant in this unethical behavior.